Hi, everyone. My name is Rabia Ali. I am a clinical research nurse manager here at Kovler Clinical Trials with the University of Chicago. Today, I'm going to go ahead and talk about some research that we're currently doing with diabetes in our community. These are just a couple of research projects. We, of course, have a ton of a lot more, but I wanted to highlight two of our research studies that we're currently doing. So I'm going to go ahead and share my screen to go over that with you guys. And just again, my name to introduce myself. One of the studies that we're currently working on, it's called the EquiT1D study. It stands for Using Technology to Address Disparities and Promote Healthcare Equity in Type 1 Diabetes. This research I'm currently conducting with Dr. Celeste Thomas. And in this research study, we're enrolling 50 participants. Currently, we have up to 14 enrolled. In terms of enrollment criteria, what criteria you may need to have, or if you know someone who has, meets this criteria would be great. You have to have a diagnosis of type 1 diabetes between the age of 18 and 64, at least 2 or more hospitalizations with diabetes ketoacidosis in the past 5 years, and not currently pregnant. In terms of an involvement, I always like highlighting this part because it kind of gives an idea to the participant how much time involvement it has, if it interferes with their work or personal life. So in this study, we do ask the participant to wear a continuous glucose monitor. This is prescribed as standard of care for the participant if they don't already have one. So it's not something that's provided by the research study. It is something that is standard of care and can be prescribed by the endocrinologist and provider. It consists of 8 telehealth visits, which can be done over the phone or video with a patient navigator. So I'm currently working as a patient navigator, doing these phone calls and video visits, and it's over the course of 12 months, so a year participation. And there are questionnaires that we do ask participants to complete at baseline, month 6, and month 12. This study is being done to see if, using technology with the help of a patient navigator can address disparities, improve outcomes, and promote healthcare equity in type 1 diabetes. During the telehealth visit, just to give an idea, what we're doing is that the patient navigator is downloading and reviewing a 14-day CGM download. So again, looking at the blood glucose levels over the course of 14 days to look at the percent compliance if, the participant's wearing the CGM for the course of the 14 days, and the time in range, which is a blood sugar of 70 to 180. This is a very hot topic right now. This is something that endocrinologists love looking at for those who wear CGMs because it gives a better picture of control, of diabetes control, and shows a better picture of what improvements can be made. We're also looking at barriers to compliance, which are explored and discussed further with the patient navigator. If we're seeing someone not wearing the CGM for certain reasons, whether it's bothering them, they're having insurance issues, that's why they're not wearing it. Any kind of barriers, we do explore that over the phone and see what we can do to help. And we do look at the blood glucose ranges, and if there's anything concerning, either very low blood sugars, very high blood sugars, the patient navigator does communicate with the patient's endocrinologist for further intervention. And the goal of the study is, importantly, it's to promote healthcare equity. We do want to increase the percent compliance by helping resolve barriers, and we want to decrease DKA hospitalizations. The second study that I wanted to talk about today was the My Diabetes, My Community study. I am one of the clinical research nurses working on the study along with 2 other nurses, and it's a huge team with research assistants, project managers, and the study is being led by Drs. Albert Huang and Stacy Lindau. In this study, it is an NIH-funded trial, and we are enrolling older adults with type 2 diabetes. Little research, as we know, little research has been done to see what approach works best for the older population with type 2 diabetes. So that's kind of what we're focusing on. And the overall goals of the study is to test different programs that help older adults with diabetes manage their care goals. The good thing about the study, Same thing with the last study that I don't know if I mentioned, it's all remote. So, participants can do the visits over the phone at home. They don't have to come in for any visits. And same thing, there are surveys that are involved in this visit that can be done over the phone or online. In terms of the enrollment criteria, we are enrolling 600 participants, so it is a big study. We're looking for individuals with type 2 diabetes, over the age of 60, have an A1C of 7.5 or greater, be a patient at University of Chicago, live in the Chicagoland metropolitan area, and they either have to have access to internet via their cell phone or have access to a personal email address. So if it's not over phone, computer, whatever that may be, have access to an email address. In this study, participants will be randomly assigned to one of the three programs we are testing. And in terms of involvement, the participation lasts 1 year. There are 3 surveys that participants are completing throughout the course of that year at 3 different time points. There's 1 study call per month, so there's 12 calls total for the study. The calls are anywhere between, I would say 25 to 30 minutes. And we do schedule those via texting system. So we do schedule the calls in advance, like an appointment, to make sure those are happening. And participants can earn up to $150 in gift cards for this study. And the goal of this study is to evaluate how, these approaches that we're taking over the phone calls, how they influence outcomes such as glucose control and hospital visits. It may reveal the best way to provide personalized care for older adults with diabetes. And that is all I have for you today. Thank you so much.